All right, folks. This is going to be a totally different kind of video. This is my public service announcement message, PSA, if you will, on wearing sunblock. So today, I'm not going to capture all of it, but today is my surgery. So, like I've shown in a couple other videos right here, I don't know if you can see it very well, that little dot. I was diagnosed with, I hope I'm saying this right, Aquinas carcinoma. Basically, there's like four types of skin cancer. The one, if you're going to get it, the one that you want to get, which is the easiest and whatnot, is basal cell carcinoma. I've actually had that before, like right here. But apparently, because I'm stupid and I'm stubborn, I'm not stupid, I'm stubborn about wearing sunblock. I got it again, but this time it's like the next level up. And from what the doctor told me and from what I've read, the big difference between the two is that the Aquinas, and like I said, I don't know if I'm saying that correctly, but this one, it's a little bit more aggressive. It spreads a little bit more faster than the basal cell, and it's usually in deeper and wider inside your skin membranes or whatever. So one of the things the doctor said, there's a potential, not definite, but a potential that with this being so close to my eye, that it could mess with my vision. And I would kind of like to be able to see. So just as a precaution and to not allow it to spread, they set me up for surgery, which is today. So we're going to take you along on the ride. And we're not going to show you the nitty gritty, but I just want to use this video as a way to really encourage people to put on the sunblock. I don't know what it is, but those rays and stuff from the sun, that radiation it's a lot more potent than I remember than whenever I was a kid. So if you're going to be outside, especially in long periods of time, whether you're just outside having fun, hiking, playing a sport, doing yard work, whatever, be sure just to put some sunblock on. It's easy, it's simple. It takes, you apply it, and before you know it, you're good to go. Also, if it's super sunny, you probably want to wear a hat just to protect you. But just use this video as a precursor to remind you to put your sunblock on. I'm after getting this the second time, and with it being worse, I'm trying to be more diligent about doing that. I've gotten myself some men's lotion with SPF in it. I think they recommend the minimum of maybe 30 or higher. The first one I got was, I think, 15, which is better than nothing, but they really recommend, I think, 30 SPF or higher. So get out there, get you some, and then we'll, protect yourself, and you can live a nice, happy, long life. I think the two levels of skin cancer after the Aquinas carcinoma is worse and more dangerous. But even with this, if you don't treat it, it could lead to some problems. So definitely, if you have an area like with this one, just kind of maybe give you an idea of how I identified this. If you wind up getting, and it was the same thing with the basal, if you wind up getting a sore, maybe you had an irritation or a pimple or something, and you've taken care of it, you've put Neosporin on it, you've done everything in the world you know to do. But 1, 2, 3 months down the road, that sucker's still not healing. It still maybe looks like a little bitty scab, not that big of a deal. It doesn't hurt, doesn't swell up. It's like a little scab that just won't heal. That's a pretty good indication that you may have some sort of skin cancer. That's what happened with both of mine, is that it just would not heal. And so whenever I went to the dermatologist, he took a little cut off of it and did a biopsy, and sure enough, it was positive. So, that is a huge red flag. If you have something that will not heal, go have it looked at. Don't let it meander and sit there and just hang out with you. So, let's head to the hospital. Okay, we're at the hospital. It's crazy around here. Pray for me. All right, folks. I'm back in the room where they're going to do the procedure. They just put the stuff inside of my head there to numb it so that we can get ready for surgery. So, like I said, I'm not going to show the actual surgery. You don't want to see that. Well, maybe some of you do, but not sure if YouTube will like that. So, this is me going, I guess, under with the numbing, and then we'll go from there. Okay, so far this does not look too bad. They've made the first cut. I think it's called the Mohs, M-O-S surgery. So what they'll do is they cut in there. This is a temporary bandage. So they cut in and they remove a segment. I don't know. They remove a segment of it, and then they're going back to the lab to test it. And then I guess as soon as that bottom layer of that epidermal skin shows none of the cancer, then we're good. They'll sew me up and make me look pretty and send me on my way. If that bottom layer still shows signs of the cancer, then they come in and they dig a little bit deeper. So you got to wait about 15-20 minutes in between, and then cross our fingers that's not any deeper, which is a good sign. But if it is, then we'll repeat the process and keep doing that until it's totally out, and the lab comes back as being positive for not having any more in that bottom layer. So now I'm just going to sit back and relax for about 15 minutes, and we'll see what happens. Okay, guys. Finally made it back home. They had to go in twice to take out the cancer. And it's left me with this. Not sure what it exactly looks like underneath that. I gotta leave this on for a couple days and take it off and clean it, and then rebandage it, and put medicine on it, and whatnot. As far as how I'm feeling right now, I am tired. The medicine that they put in to numb it, the anesthesia, starting to wear off. So I just took, they really want to hold off with giving you like a prescription painkiller unless absolutely necessary. So they said to take some Tylenol. So I've taken some Tylenol, and I'm just gonna try and rest. Right now it hurts. It's starting to hurt. And sorry, I'm a little out of it right now. But anyway, this is where I'm at. So in a couple days, I will get back on here and do a quick update of what it looks like without the bandage. I'm really kind of curious. I don't know if it's as big as this one was. This one was about 1.5 inches down and 1.5 inches over across my eyebrow. So I'm curious to see what this one is. So, excuse me, I'm gonna let you go right now. In a couple days, I will add to this and we'll see what it looks like. Okay, guys, with documenting this journey, I'm gonna try and do like a little updated vlog every day. So we're on day 2. the day after surgery. I'm still wearing, the bandage. But woke up this morning, the whole right side of my head is just throbbing with pain. What they say in the post-surgery paperwork, they really are hesitant about prescribing prescription painkillers. They really, there's a lot of heightened concerns about getting addicted and stuff like that. I don't like pills, so I'm not someone who might abuse that. I guess there are probably some people who do, but what they want you to do is it's a regimen of every 3 hours, alternating between Tylenol and then ibuprofen. So I started doing that. In about an hour or so, I'll take the next dose and go from there. But they did say that if that doesn't work, then to give them a shout out, and then they'll see about maybe getting something called in. But I got to try this method first. So that's where we're at today. Excuse me. Just real achy in the side of my face where they did the surgery. This whole area just hurts. But that's it for today. See you next vlog, or whatever you want to call it. All right, folks, this is day 3, and I get to take this off, look at it, clean it, and I get to finally take a shower. So I was told that I could not take a shower for 2 days with having this thing on. I guess I could have taken a bath without getting my head wet, but that's part of the reasons why you stay at home and you rest and you don't stink up anybody. So let's take this thing off and see what it looks like. So let's see here. All right, are we ready? I hope it's not that bad. This thing is really sticky. Woo. Well, they put a lot of tape on this thing. All right. Trying to be real gentle because it does have the stitches in it. Golly. All right. Oop. Okay. Just a little bit of blood on the gauze. What the hell is this thing? Wow. Look at that. They did an amazing job. Okay. I'm hoping I get that angle right. They did an amazing job. Look at that. You can hardly even tell. I mean, there's a little bit of a line right there, but wow. That is amazing. That is so amazing that they were able to do such an awesome job. Let's get that in the light. Wow. So, I had a great surgeon. And like I said, you can barely, every now and then you can see this scar right here. But that was phenomenal. Absolutely phenomenal. So, I'm gonna make this a non-R-rated video. So I'm gonna turn it off. I'm gonna take a shower, clean up, put some medicine on this, and call it good, baby. Call it good. So let me get back with you after I get cleaned up, and I'll have some final comments. Whew. So, final thoughts. I am just so impressed by how well that looks. I mean, you can still see the scar, but in time that'll fade away a little bit. I'll always have a little bit of something there to remember it by, but it's more of a reminder. And that's what this whole video is about, if you've made it this far. it is a reminder that you need to quit being stubborn. You need to get off your butt and go get some sort of, this is mostly for men, go get some sort of face lotion that has SPF in it and apply it daily. This is gonna help protect you. It's gonna prevent you from having to go to the hospital, go to your dermatologist, go through this whole process because it'll creep up on you. You feel okay, but all of a sudden you have something that won't heal, and then you got to go to the doctor and find out what's going on, and it comes back positive. And if you don't take care of it, it could to develop into something even worse than what you initially had. So to not have to deal with all that, just get some lotion, get some SPF, smack it on, and you're good. It doesn't 100% guarantee that you're not going to get it, but your odds of not getting it are highly increased. So again, go out and get some. It'll make for an easier time. I will say that I do feel where they had to scrunch the skin to do the stitching. The nice thing is whenever I had the basal cell, they used staples, and so I had to go in, and I looked like the Bride of Frankenstein, and they had to go in and remove those. This time they used the kind of stitches that basically just disintegrate. And so that's cool. I don't have to go back in until my 6-month checkup. So I am good to go. I do still feel some pain. There's still quite a bit of soreness right here. But it's manageable. Doing that every 3 hours, alternating between Tylenol and ibuprofen has actually helped. I was kind of surprised because at first I didn't think it was going to touch it, but it actually did its job. In fact, it's time for me to get around to medicine right now. But it's working. The doctor did his thing. Now I'm letting my body recover. I'm glad I took some time off. I think by the time I have to go back to work on Monday, I should feel a lot better. I think by Tuesday or Wednesday, I'll be able to slowly get back into the gym. Maybe not lift anything super heavy the first couple days that I'm back, but I can start working my way up for my next competition. So in the meantime, I'm just gonna keep recovering. I'm gonna keep resting, taking my medicine. I put some Aquaphor on this. It'll kind of help protect it, and it'll help with the scarring to make it maybe less visible. They recommended Vaseline, but I don't have any of that stuff, so I used what I had. Let's see here, is there anything else I'm missing? I can't think of anything else I'm missing. So I'm gonna end this video. I'm just gonna restate that don't be like me, don't be stubborn, put some lotion on that has SPF in it, and protect yourself, because everyone's gonna want you looking pretty. But in the meantime, chicks do dig scars. Get your fit on.